These next two sections are going to talk about aminoglycosides. Aminoglycosides are really powerful antimicrobials, but they have some pretty serious side effects. So that's why I'm going to take a couple of shorter videos to talk about them. So we use them for aerobic gram-negative infections that we're really worried about. We want to get a hold of them really fast. But they do have some drawbacks. So the main drawbacks are these two. They're nephrotoxic and they're ototoxic. So we need to be careful how they are used. So their spectrum of activity is that they're very effective with aerobic bacteria, but they're ineffective against anaerobic, and you're going to learn why that is. They are bactericidal. They are effective against gram-negative. So if you put that together, they're effective against aerobic gram-negative bacterial infections. So the reason why they are only effective in aerobic situations where we have air is that um, the the main mode of action is that they act on ribosomes and affect the production of essential proteins. In order to get to the ribosomes, if you remember, ribosomes are on the inside of the cell. They're inside of the cell wall and the cell membrane. And in order to get in there, they need an oxygen dependent mechanism. The reason for that is that they are, in most physiologic pHs, they are hydrophilic. So they don't tend to go across the cell membrane on their own. They need this oxygen dependent mechanism to get them across the cell wall. We can sometimes combine them with something such as the cephalosporins um, or penicillins because those disrupt the cell wall, and so they can get um, into the bacteria in order to be effective. But if you're already using something that's going to destroy the bacteria because it's going to cause a disruption in the cell wall, you probably don't need the two. But if you needed um, to make it, really effective, you could combine those two. So the typical names end in mycin or mycin, spelled with either an I as the second letter or a Y as the second letter. There are some tetracyclines that also have this mycin in the name, so you have to be careful not to confuse them. But in general, this is a way to recognize the aminoglycosides. So some of the names: gentamicin, amikacin, neomycin, apramycin, kanamycin, and tobramycin. And by far, the ones that we use the most are gentamicin and amikacin. Neomycin is one that we use topically, and if you remember when I talked about bacitracin in the last video, it's a combination topical that is used. So there is some resistance. There's some cross-resistance between members of the aminoglycoside family. This isn't as common as in the penicillin family. When there is resistance, it's usually due to some destructive enzymes that the bacteria has to the aminoglycoside, or they don't have that oxygen-dependent mechanism to get them across the cell wall and cell membrane. So those are the typical things that lead to resistance. So I mentioned that these are hydrophilic for the most part, and so we end up giving these parenterally um, so that they travel through the extracellular fluid and then get into the capillaries and go systemic. When we do give these orally, they're intended to stay in the gastrointestinal tract and act there. While they don't go across intact skin, we do use these for when we have a wound, an open wound, a degloving type of wound, or just a very open area, as you can see in this limb wound. This is not quite degloving, but pretty seriously denuded skin there. So when we have that situation, we can use it. this is a bag of fluids with a stopcock connected to it. And the stopcock simply is a way of refilling this syringe. So rather than poking the syringe in the bag over and over again, you can just refill it by closing off one side of the stopcock that allows this part to be refilled. Then you would close it off, and then you'd use this end that might be attached to a needle like this, and then flush the wound. And you probably covered this in surgical nursing or are covering it in surgical nursing. And you're flushing the wound with a solution of the antibiotic. We can also do what's called infusing, basically use a cannula or catheter um, to put a solution of an aminoglycoside into the bladder or the uterus to help um, with infections. Just put it there directly so it doesn't have to go through the body in order to be there. It's not going to be absorbed into anything else. It's going to stay in the uterus or the bladder and have a lot of time there to act. So, because obviously it's not lipophilic, it does not penetrate the blood-brain barrier or the eye to any significant degree. We can give it in the lungs via a nebulizer. So it tends to stay where we put it because it's not going to cross those cell membranes. So the thing that is very characteristic about these drugs, this group of drugs, is that there is an active transport system that carries it into the kidneys and into the inner ears. And that's why, so it can accumulate in high concentrations in those two areas, and it can lead to being nephrotoxic and ototoxic. Just like any other drug, it's going to cross the placenta. So we would not want to use it because when we have developing fetuses, it can enter their kidneys and eyes selectively as well and affect them. So not something we want to use in pregnant animals. It's excreted very readily into the kidneys, through the kidneys and into the bladder. It has a very short short half-life, and it is typically eliminated within a couple of hours in most species. It is because it is excreted in the urine, it can be good to use it for bladder infections.